everyone. So I'm really excited today to talk to all of you about nipple versus open pail feeding because this is a question that I get a lot on farm. So can I feed my cows with pails or are nipples preferred? So I'm going to answer this question for you today. However, do keep in mind there are still a lot of unanswered questions due to limited research. So let's start with Mother Nature. Notice the position of the calf in this picture on the right. So when a calf is suckling off of its mother, the neck will be slanted downwards from the shoulders, the neck will be fully extended, and the head will be tilted upwards. So the nose is not elevated above the eyes. So this is the natural suckling position for a calf, and this will promote efficient esophageal groove closure. So why do we want the esophageal groove to close? Or maybe you're wondering, what is the esophageal groove? So a quick anatomy lesson. We know that when a calf ingests solid feed, it travels to the rumen. And when it ingests water, it's designed to travel to the rumen. And when ingesting milk, it's designed to travel to the abomasum. However, this does not always happen. So let's start with suckling. I took a picture here on the left. I put my finger in the calf's mouth to try to help you visualize it. So a calf will extend its tongue forward over the bottom teeth, and it will form a semicircle with the surface of its tongue. So this suckling action will force milk out of the nipple by creating its own straw of sorts, and it will then swallow the milk into the esophagus. Whereas if we are drinking from an open pail, this will eliminate the suckling action. So calves are forced to use their entire oral cavity to act as a big straw to ingest the milk. So as milk travels down the esophagus, it will reach the esophageal groove. And this muscular structure is significant because it determines where the liquid will travel to next. So through muscular contractions, the esophageal groove will close, allowing milk to bypass the rumen and flow into the abomasum. And this is what we want. If the esophageal groove remains open, milk will travel to the rumen, and this is undesirable from a physiological and a nutritional standpoint, which I will touch base on a little bit later. So the esophageal groove is closed, the milk travels into the abomasum. This is where the nutrients are digested so that when it flows into the small intestine, it's ready to be absorbed. So there are several factors that will cause the groove to open and close. The feeding mechanism, so a nipple versus a pail, the drinking speed, the body position of the calf, and additional stimuli. So if you're feeding with a nipple versus a pail, one study showed that when calves suckled milk through a nipple, only 2% of milk entered the rumen compared to over 50% when drinking from an open pail. So this is significant. However, later research concluded that esophageal groove closure, it was similar for both nipple and open pail feeding. So there is some debate. However, all research is conclusive in that when we feed through a nipple, it will provide consistent, efficient groove closure, whereas there's greater variability with open pail feeding. Drinking speed. All right, we're going to take a look at Stella here because Stella clearly has a drinking problem, no pun intended. Some of you may have seen this. Okay, so Stella, she obviously has larger swallow sizes feeding from an open pail, and this is going to allow the milk to escape from the esophageal groove, so it's more likely to flow into the rumen. We also want to slow the rate of ingestion, slow down the drinking speed so that we can allow for efficient closure of the groove. Now, one study showed that 1 to 2 week old calves drinking from a nipple, they require 4 to 6 minutes to finish a meal, versus calves on an open pail only required 40 seconds. And if we compare this to nursing from a cow, nipple feeding is about 35% faster and pail feeding is 85% faster. So the rate at which a calf consumes milk, this is going to affect the rate at which the liquid feed will move through the digestive tract. Okay, body position can also affect closure of the groove. So the picture on the left, the calf is drinking from an open pail. Its neck is relaxed, the head is tilted downwards, and so the esophageal groove may not close properly and milk may leak into the rumen. The picture on the right, the calf's neck is extended and the head is horizontal, so the nose is level with the eyes, and this will promote effective closure of the esophageal groove so that milk travels to the abomasum. Now keep in mind, this picture on the right, the neck should actually still be below the shoulders. Now, multiple studies have proven this. However, there was a study that demonstrated the position of the calf's head and neck. It actually had no effect on the reaction of the groove unless it was in extreme positions. But interesting enough, it did affect the potential for milk to enter the trachea. And this is because the epiglottis will move forward by reflex action. So it moves out of place, it opens the trachea, and there's potential for milk to travel to the lungs and resulting effects, potentially bacterial pneumonia. Okay, so if you are nipple feeding, I just want you to keep in mind the correct body position. So I took a few pictures here on our farm. So this picture on the left, this is an exaggerated position. The neck is extended way above the shoulders. The head is vertical. The nose is clearly elevated above the eyes. And so here, milk may enter the trachea. And despite the calf drinking from a nipple, some milk may enter the rumen as well if the esophageal groove is not closed completely. This middle picture is a little bit better. So the neck is extended level with the shoulders and the nose is slightly above the eyes still. And ideally, this is what we want to see, the picture on the right. So the neck is extended below the shoulders, the head is horizontal. I really want to drill that in today. When you go to feed your calves tonight at home, make sure that their head is not vertical, that you are keeping their eyes in line with their nose. And this will promote effective groove closure. And lastly, additional stimuli. So believe it or not, the chemical composition of the fluid may influence groove closure. So the components in milk or milk replacer are more likely to cause the groove to close so that it travels to the abomasum, whereas with water, it is more likely for the groove to remain open so that it can travel to the rumen. Anticipation, so visual stimuli. How many times have we walked in a barn and that calf will associate you with their milk meal? So they're getting really excited and that can actually cause the groove to close. And one study confirmed this, that the presence of farm workers who fed calves sometimes caused complete closure of the esophageal groove. So now that we know what factors are causing the esophageal groove to open or close, let's discuss how the feeding method will affect the calf. So open pails can occasionally lead to ruminal drinking, and this is where most of the milk will enter the rumen, and calves can develop feed intake and weight gain problems. Overall, this appearance is commonly referred to as hay belly, and although that's the incorrect term in this case, calves will have a short, squatty stature with a low slung, distended belly. So milk that enters the rumen will undergo fermentation, and sometimes this can lead to ruminacidosis. Ruminacidosis is when the pH of the rumen is too acidic because of the bacteria that's fermenting the lactose from milk or milk replacer. And if we have a persistent low rumen pH and lack of solid feed, this can cause damage to the wall of the rumen. And in severe cases, it can create parakeratosis, which is just a nasty inflamed layer of plaque or ulceration in the rumen. Now, this is not very common on dairy farms. It's more common on veal operations where we're really pushing the volume and the concentration into these calves. So how do we prevent ruminal drinking? Well, we need to ensure that we are closing the esophageal groove. So typically, ruminal drinkers are very aggressive. They will have larger swallow sizes. So we need to slow down the drinking process. We can do this through multiple smaller feedings, but more effectively would be to use a nipple and ensuring that the size of the hole in the nipple is not too large. We also want to minimize stress. So because we know anticipation and excitement can cause the groove to close, if a calf is timid, weak, or stressed, the groove may not close completely. So it's important that we are consistent, especially with our feeding times. We want to prevent calves from gorging their milk in a matter of seconds. And also milk temperature. So there was a study that showed warm milk caused the groove to close more effectively compared to cold milk. Physiological processes. So the slower consumption rate with nipple feeding will enhance saliva production, which makes sense, right? We're making these calves work harder for their meal. And we want more saliva production because it will produce more salivary lipase. And this is what promotes digestion of fat in the abomasum. There will also be more secretion of abomasal enzymes and digestive acid. So that will also promote fat as well as protein digestion in the abomasum. There was a study that actually showed a 3-fold increase compared to open pails. But this is really important overall because the more digested nutrients that we have in the abomasum will then flow into the small intestine so that it's ready to be absorbed. If we compare this to pail feeding, we can potentially get into some digestive problems. Because there is less saliva production, there will be lower levels of salivary lipase. So this is going to allow more intact fat to pass through the abomasum, which is going to delay digestion. So if more digestion is pushed to the small intestine, the pancreas kicks into gear and it will secrete more enzymes, which will then enter the upper portion of the small intestine to digest these additional nutrients. So a study was conducted and it proved that calves that are fed with open pails, they can handle this. It's fine. However, there is a narrow window for the effective digestion and absorption of the fat and proteins. So most fat absorption will occur in the first 30% of the small intestine. So if these nutrients are not digested and absorbed in this narrow window, then they will be passed through the calf and wasted. Okay, so feeding method will also affect calf health. Now there's a lot of variability with scours. Some studies have shown fewer episodes or less severe scouring with nipple feeding, while others did not. So there's not a lot of conclusive research there. But with heart rate, nipple-fed calves, they may have a lower heart rate during and after feeding, and they may return to a resting state more quickly after a meal compared to calves drinking from an open pail. So here we're really minimizing stress, which is great. It can also lead to aspiration. So pail-fed calves, they're more likely to aspirate milk into their air passageway and into their lungs. So this may increase the prevalence of pneumonia and corresponding treatments. And a telltale sign that a calf is aspirating is, it's obvious if they're coughing, but if you notice a raspy or rattling sound during breathing after they have finished drinking, that's a good sign that aspiration has occurred. So let's recap. overall, what are the benefits of nipple feeding? It provides consistent closure of the esophageal groove so that milk will travel to the abomasum. It will slow the passage rate, so the drinking speed, for optimal digestion. It will increase saliva production so that we have more nutrients being digested in the abomasum, ready to be absorbed in the small intestine. It lowers the heart rate, so minimizing stress, and mentally it's very satisfying. It satisfies the calf's suckling reflex. And lastly, it's natural. So calves were designed to suckle from a nipple, and they will learn very quickly if you train them on a nipple. What are some limitations of nipple feeding? The volume per feeding, especially if we're feeding with bottles. They can be more difficult to clean, the bottles and the nipples, compared to pails, and it can be labor intensive if it's not set up efficiently. However, larger farms in the US that have had issues with pail feeding and pneumonia, they have implemented efficient ways to use bottles. So a couple of options for you, depending on the size of your farm. These farms in the States, they will attach a cart behind a gator of some sort, and one person will drive while the other person will place bottles into the holders. Maybe what's more realistic is you can cut holes in the bottom of the bottles, and if you have a mobile milkmobile, you can use that with a dispenser to fill each bottle. Just keep in mind that you do still need to clean those bottles after every feeding. And larger farms have also purchased industrial dishwashing systems to wash their bottles, so it speeds up the process. Just make sure that the inside of the bottles are being cleaned properly with those systems. So what are the benefits of pail feeding? You can increase the volume, much easier to clean, and they are convenient. And I do want to point out there are a lot of people or producers that do feed their calves with pails, and they do so successfully. So it can be done. I just want to point out the differences between the two methods today. But I want to make it clear that this isn't to say that pail feeding will end up being a disaster. It will, and it has been proven to work on farm as well. Now, some potential limitations for pail feeding. It is more unnatural for the calf. There's greater variability in esophageal groove closure. It can lead to ruminal drinking because calves are consuming milk too quickly. And there are more pancreatic secretions required to digest the nutrients in the small intestine. However, the pancreas is able to handle this. And there is a narrower window for the nutrients to be digested and absorbed. So now we're going to talk about some practical on-farm recommendations. So how do you feed your calves? Maybe you use an open feeding trough, or you use a nipple pail, an open pail, a milk bar with teats, or the traditional bottles with nipples, or maybe you're on an auto feeder. If you are group feeding your calves by hand, I would strongly recommend using a milk bar with teats. So notice the picture on the left. This allows for the correct body position for the calf. It slows the drinking process. There will be increased saliva production, and it enables suckling for the milk to travel to the correct destination, the abomasum. My second recommendation would be to use a milk bar that has individual compartments. So I purchased this one for about $170, and the brand is Stallion, and it has the peach teat nipples, which I really, really like. And the reason I recommend individual compartments, it's pretty obvious from this picture on the right. It's a great way for us to monitor intakes and to ensure that each calf is getting a consistent meal size. So it's obvious that these calves have different drinking speeds, or maybe this one calf here is not feeling well and it needs some extra attention. Bottle holders. So if you are using bottle holders, I hung this one over a gate in our barn and it is not in the correct position. So the upper portion needs to be sitting against something. because right now the nipple is facing the ground. It's also placed too high. As we can see, the nose is elevated above the eyes, so there is a greater potential for milk to enter the trachea. The picture on the right is what our goal is. So we want the bottle to be tipped at about a 30-degree angle and position the holders to keep the calf's head more horizontal than vertical. So what's the proper height for nipple and pail feeding? If you're feeding with nipples, I would recommend that you measure the distance from the bedding surface to the calf's nose at a normal feeding position, and this should be the height of the nipple. Now with pails, they should be placed low enough to allow the youngest calf to reach the bottom of the pail without any pinching or binding of the neck. So the average height, and this is what some auto feeder companies will recommend as well, the average height is about 20 to 24 inches. That's for both pail feeding and nipple feeding. So for pails, you should be measuring from the top of the pail to the bedding surface. All right, so the size, the resilience, and especially the opening in the end are very important factors when we choose a nipple. So we've all done it. We've been frustrated. We lose our patience. A calf is taking forever to drink its meal. So we take our jackknife and we just make the hole a little bit bigger. But I'm here to tell you that this is not a good idea. You need to stop doing this because it completely defeats the purpose of using a nipple. So we're wanting to slow down the drinking speed, not speed it up. If we speed it up, this is going to result in more milk leaking into the rumen. There will be less saliva production. The calf is not having to work as hard. And if the opening is too large, this can also lead to tracheal contamination, so more milk in the lungs. Now on the flip side, the picture on the bottom right, this is how the nipples come. So if it's any smaller than this, I would make the hole a little bit bigger, but this is the optimal size on the bottom right. If it is too small, the calf may become exhausted before it has finished its full meal of milk. There's also a little tiny hole on the side of the nipple, and just ensure that that is actually poked all the way through because it will help to relieve pressure from the bottle, and that will make it much easier for the calf to consume its meal. And lastly, so this is going to be a future topic in our webinar series, the importance of water, but I did want to make one quick recommendation. So we know that the primary role of water in pre-weaned calves is to promote rumen development, and it will provide the medium for starter feed digestion, and it encourages starter intake. So there are quite a few producers that will feed water immediately after a meal of milk to their calves. And what I would recommend is to wait at least 30 minutes, preferably 1 hour. I realize this may be impractical for some, but you should wait this time after milk feeding to offer water to calves, because this delay will allow sufficient time for the esophageal group to relax and open again. So it makes it more likely for water to enter the rumen. In addition, this delay will also allow proper time for the clot formation to happen in the abomasum for proper digestion. So if we feed water immediately after calves have drank milk and it does go into the abomasum and that clot has not formed, it's now diluted, it's more difficult for the clot to form, and it's making it more likely for those nutrients to be passed through the calf, and this can lead to nutritional scours. Lastly, offering calves warm water will significantly increase intakes compared to cold water. And that's it. So at the end of the day, whether you choose to feed from a nipple or a pail, you can do so successfully. Just keep in mind the points that we discussed today. So with that, I will open up the floor to some questions and invite the rest of the Grover Young Animal Specialists to join me.
Kind of segued nicely into our nipple versus pail feeding question and left everyone with a bit of a cliffhanger. So to get to that, let's start there. So the question was, if you put a nipple in a pail, will it prevent ruminal drinking, and will it affect drinking speed?
Yeah, so if you put a nipple in a pail, it will definitely help to prevent ruminal drinking because it's slowing down the drinking speed. So we're going to allow the esophageal groove to close properly so that milk will travel to the abomasum. However, I would keep in mind that if we do put a nipple in the top of a pail, the calf is still not in an ideal body position. So the head is still tilted downwards. So this can still potentially allow a little bit of milk to leak into the rumen or into the trachea and corresponding effects into the lungs. But I would say it's not significant enough that it would cause ruminal drinking. So for those of you that are pail feeding and limited to making changes, that is a simple fix to add a nipple in the top of the pail.
So another question that came through was that we've talked a lot about nipple feeding and pail feeding. Can you comment on tube feeding calves? When would you recommend using a tube and when would you not?
That's a good question. So we know that when we tube calves, the fluid will travel into the rumen. So for colostrum purposes, if the calf will not drink, it's crucial to get that colostrum into the calf. So I would definitely recommend tubing it. Because time is of the essence, we need to ensure that that calf gets colostrum to absorb the antibodies and boost its immunity. And a study was actually done that showed there is no significant difference between tube feeding calves colostrum and nipple feeding calves colostrum in regards to failure of passive transfer. So I thought that was interesting.
Awesome.
Now, aside from colostrum feeding, if we have an older calf that is sick, I would not recommend tube feeding milk, but I would recommend tube feeding electrolytes. However, if we're at the point where the calf suckling reflex is very weak that we're having to tube electrolytes, we may want to consider additional routes to give those electrolytes, for example, IVing the calf. But I would recommend consulting with your vet.
This one is around feeding the electrolytes, like you just mentioned. How would you recommend feeding electrolytes on farm?
I would say whatever the calves are used to. If you feed from pails, you can offer electrolytes through a pail or a nipple, whatever they're accustomed to. Depending on the severity of dehydration, again, consult with your vet, but you can look at additional ways to administer the electrolytes.